Choking happens quickly and more often in children and infants than in adults, so it's important to be prepared in case you need to help a child in distress. Choking occurs when something gets stuck in someone's airway and makes it hard for them to breathe. A child experiencing mild choking can still breathe, speak, and cough. You may not need to intervene in these cases. A child experiencing severe choking can no longer breathe, speak, or cough. This is an emergency. Any child who is severely choked should be evaluated by a healthcare professional. It's not always easy to tell if a child is choking. If you're unsure, ask the child if they are choking and if you can help. If the child's face becomes discolored, if they're struggling to breathe or make sounds, or if they're grabbing at their throat with their hands, they are severely choking. If someone else is nearby, have them call 911 and get an AED while you help the child. Get into position to provide choking relief right away. To help a child who is choking, position yourself by kneeling behind them. Depending on your size and the size of the child, you may need to stand. Kneel while giving yourself a steady base and place one hand on the child's shoulder. Then use the heel of your other hand to give them 5 forceful back blows between the shoulder blades. This will push air from their lungs, helping to force out the object that's blocking the airway. If the 5 back blows do not clear the airway, move on to abdominal thrusts. For abdominal thrusts, wrap your arms around the child's waist so that your hands are in front. Make a fist with one hand and place it thumb side against the child's waist, just above the belly button and well below the breastbone. Now, grab your fist with your other hand. Next, give quick inward and upward thrusts to the abdomen, making sure your thrusts go upward and not straight back. Thrusting upward acts like a cough, pushing the air out while reducing the chances of causing injury to internal organs. Alternate between giving 5 back blows between the shoulder blades and 5 abdominal thrusts until the object is forced out and the child can breathe, cough, or speak, or until they become unresponsive. If the choking child is too large for you to get your arms around their waist, or if they're in a wheelchair, give chest thrusts instead of abdominal thrusts. This is the same method used for large or pregnant adults. In these cases, you'll need to change your hand position and pull back on the chest and not up on the abdomen. Now, I'll demonstrate the correct hand position for chest thrusts. Remember, make a fist with one hand and place it thumb side against the child's torso. Place your arms under their armpits and your hands in the center of their chest on the lower half of the breastbone. Pull straight back to give chest thrusts. If the child becomes unresponsive, carefully slide them to the floor face up by slowly walking backward, supporting their head and neck. Start CPR immediately and use the AED as soon as it's available. Have someone call 911 if they haven't already done so. After giving 30 chest compressions, look in the child's mouth to check if the object has come out. If you can see the object, take it out. If you can't see the object, do not reach into their mouth to try and find it. You can accidentally push the object in farther and make things worse. Now that you've checked for the object, give 2 breaths. Continue cycles of giving 30 compressions, checking for the object, and giving 2 breaths until emergency responders arrive or the child starts responding and breathing normally. If you're alone with a child who becomes unresponsive after choking and you do not have a phone, it's important to complete 5 cycles of CPR, starting with giving 30 compressions, checking for the object, and then giving 2 breaths before you leave to call 911 and get an AED. Any child who receives choking relief should be seen by a healthcare professional. Now, you're ready to help a child who is choking.